Physiotherapy for balance problems. People with balance issues may feel physically weak, unstable, or unsteady, or as if the room is spinning while standing, sitting, or lying down. For example, stroke survivors. I'm your host, Chinedu, your favorite online physiotherapist. Learn, grow, and connect. Balance is a fundamental aspect of our daily lives, often taken for granted until it becomes an issue. Whether it's getting out of your bed, strolling through the park or street, or climbing stairs, balance plays a vital role in our ability to move safely and confidently. However, as we age or grow older, we are faced with certain medical conditions. Maintaining balance can become challenging and the risk of falls increases. This is when physiotherapy steps in as a valuable ally in helping individuals regain and enhance their balance, ultimately preventing falls. Balance problems are caused by a disconnect between your ear's vestibular system, eyes, and your musculoskeletal system. Ordinarily, your body sends signals to your brain and moves appropriately in response. So when at least one of these areas is malfunctioning or is affected by a medical condition like stroke, a balance issue can result. Physiotherapy can help you manage symptoms and adapt to your environment. Here's what you should know if you have a balance disorder. Signs of a balance problem. Balance problems often start with your ears. If you regularly experience a combination of the following symptoms, you could have one of these balance-related conditions. Vertigo or spinning as you stand, sit, or move. Feeling lightheaded or dizzy. Feeling physically unsteady. Vision changes. Mental confusion. In turn, you may find it difficult to stand, sit upright, or even maintain or remain still. Considering the relationship between your ears, eyes, and musculoskeletal system, including your bones, muscles, okay, and your ligaments, balance problems can arise from muscle changes, joint stiffness, or restricted range of motion or movement. Inner ear issues, including an infection, head injury or trauma, blood circulation disorder, high or low blood pressure, sedentary lifestyle, aging, stroke, like I mentioned earlier, multiple sclerosis, Parkinson's disease, chemical changes in your brain, medication, side effects like some certain medication, arthritis, diabetes, effects of balance issue. So balance issue vary, including when you experience symptoms. The signs the signs emerge once a person moves or attempts to perform a task or carry out a particular activity. So balance may also change in relation to the condition of a space. For instance, an adjustment in lighting. These factors increase risk for a fall and impact how well someone performs everyday activities. You might avoid certain motions, movements, or attempt to sit still for most of the day. However, limited activity can also result in a sense of isolation and increased risk of depression. Treatment for balance problems. In case you are watching me and you have issue with balance, coordination, and stability, this is for you. After you have been assessed for one of these issues, you may be referred to physiotherapy sections. Have 3 general objectives: to help you adapt to living with balance issue, remain physically active, and develop strategies for doing so. Physiotherapy starts with an assessment to identify when you experience balance problems or issues, the degree of severity, how they impact your life, and where and when the symptoms emerge. So your movement, strength, coordination, balance, and ability to visually track an object will also be assessed. From this point, your physical therapist or your physiotherapist will offer recommendations for balance aids and strategies to reduce fall risk, like wearing certain types of footwear and making modifications to your home. Okay? Help improve your mobility, that is your movement, and simultaneously address your fear of falls to improve physical strength and coordination. Provide exercises to improve static and dynamic balance. Target your core as well as your trunk area and help to strengthen the muscles responsible for improving posture and balance. All right. Now, it will also address any related conditions impacting your mobility and balance, including joint issues, restricted mobility and flexibility, and poor posture. So all these are things your physiotherapist would definitely consider before deciding on a particular treatment plan that is specific for your needs and goals. So your physiotherapy will also help you become more physically active, recommending exercises based on your condition and recovery. Okay, so the experts at Panesia Clinic online consultation can help with your balance issue. To learn more about our approach to vestibular and balance rehabilitation, contact us to schedule an appointment, slide in a DM, and all your questions will be answered. And now, if you have found this information helpful, please follow for more updates. Subscribe to my YouTube channel at Chinedu Okbai. Now that we have explored balance problem and how physiotherapy can help you, like, share, and follow for more updates. I remain your favorite online physiotherapist, Chinedu. Stay curious until I come your way next time. Bye-bye.